from a functional medicine standpoint, we don't need a diagnosis. We just need to understand how is the body not functioning. Again, purpose of diagnosis is to match a pill to the ill. You don't really need a diagnosis to make changes in your diet. There's so many things that can be done without necessarily having a diagnosis. Many people are not treated because there's no diagnosis, but then they do absolutely nothing as opposed to something. And if you catch certain processes early on, you can actually reverse them. But once you arrive at a point where you meet the criteria for a diagnosis, sometimes it's too late. So welcome, Dr. Achina Stein. She's a board-certified psychiatrist who's been in practice for over 25 years. She has a busy private practice called Functional Mind in Providence, Rhode Island, and she's also the clinical director of the Healing Depression Project. She's a certified practitioner of the Institute for Functional Medicine, a distinguished fellow of the American Psychiatric Association, and was awarded the Exemplary Psychiatrist Award by NAMI Rhode Island in 2008. She's a former clinical assistant professor of psychiatry and human behavior of the Warren Alpert Medical School of Brown University. And she's the author of What If It's Not Depression? Your Guide to Finding Answers and Solutions. Propelled by her son's health issues, she found that functional medicine resolved not only his problems, but hers as well. So Dr. Stein is a conventional psychiatrist, a very successful one, who also successfully incorporates functional medicine into her practice with fantastic results. And I think you will love this talk. So welcome, Achina, and thank you so much for being here. Kiki, thank you so much. I can now see you. I really appreciate that introduction, and I'm so happy to be here. I'm hoping that everyone has had a wonderful time so far on our first day and enjoyed Dr. Porges and Dr. Ackerley's lectures so far. I have a whole lot of information to share. I needed to narrow down a 2-hour lecture down to one. So I'm going to be flying through my notes up till the meat of my topic, which is the 5 R's of gut restoration. The beginning of my lecture will really be just an overview of what's been going on and then going into the meat of my lecture. So you'll have notes, I'm sure, to review on your own time in the very beginning, but then I'll slow down for the 5 R's of gut restoration. Okay, so I'm going to share my screen. I'll be talking about an overview, basically, of functional medicine and psychiatry for depression, anxiety, and other mental health disorders, but honestly, just depression and anxiety. Okay, for some reason, my screen is not advancing. Okay, there we go. I figured it out. All right, so these are the objectives. I'm not going to read them. You can read some of these things on your own time. So just to give an overview, I know the audience is quite varied, and it may even include clients and family members of people with mental health disorders, but also many clinicians. The standard psychiatric care is typically, and I'm going to basically be using the word psychiatrist or physician because I am one and I can only truly speak from my field and training, but I acknowledge that there are wonderful and competent naturopaths and nurse practitioners and chiropractors and LMHCs and PsyDs. There's so many wonderful practitioners in their expertise, but from my point of view, I'm just going to be speaking about psychiatry and care from my point of view. So what I typically have done, at least as a conventional doctor when I was one over 12 years ago, I practiced conventional medicine for 20 years before I became a functional medicine psychiatrist. We typically did an initial evaluation that was, when I first started, 90 minutes to 120 minutes
and it's been whittled down over the years to 45 minutes. And the primary purpose of that is to basically go down this decision tree in order to match a pill for a specific diagnosis. And the purpose is to get a diagnosis and match a pill for that ill. And certainly there's other reasons why we do that, but the primary reason is for pharmacotherapy. And hopefully someone has also done a full medical workup in the process. And, psychotherapy might be offered by the psychiatrist or referred to a psychotherapist, like I mentioned, PsyDs, LMHCs, LICSWs, and possibly other integrative adjunctive therapies, massage, yoga, exercise, acupuncture. And the standard psychiatric workup consists of typically a complete blood count, comprehensive metabolic panel, thyroid stimulating hormone, and it's just the TSH. You'll learn from Isabella Wenz how that is not sufficient. A folate and B12, and sometimes what's added, depending on the age and other circumstances, a lipid panel and a hemoglobin A1C to look at blood sugars. So the current model is basically focusing on an individual's organ system. So psychiatrists are typically looking at the software of the brain, so to speak, and it's usually a silver bullet approach. So the purpose is to name what it is, what's going on, what is it, and it's usually a diagnosis in the DSM, blaming it on that, and then taming it with medications. And that's an acute care model. And you'll find that in more and more that people have chronic disease, not necessarily acute disease. So this is where functional medicine comes in, and it's really right for the person who has numerous issues happening for a chronic for a long time. And that's really, the purpose of functional medicine. Conventional medicine is really most appropriate for acute issues, acute disease, acute illness, and it doesn't work for chronic disease. And I write here, those who Google search, the people who Google search and try to figure out are the most curious. They're the ones who want to know why, they want to know what's going on, and they want to know what to do about it. And they're probably the most motivated to be able to make changes, to take action and make changes. And to me, I love people who Google search and try to figure things out. They just then figure out, oh, I can't do by myself and I need help figuring it out. Then there's the people who have poor or partial response to medications. They find that medications are pooping out. They require higher doses or additional medications, and they're still not responding. You'll find that people are on 4 or 5 different medications, and then they just are having serious issues just from the side effects of those medications. And the benefits really don't outweigh the risks anymore. And sometimes people don't really see that happening. Some people have very serious side effects or intolerance to medications, or they just don't want to take medications. So these are the criteria or the types of people who like functional medicine, or who might be a good candidate for functional medicine. And for those who are not ready, I usually just plant seeds and have them, to educate them. I have them read my book to educate them about what functional medicine is and how to move forward. And if anything, to follow people on social media, people like Mark Hyman, he's a great person. And there's all the people that you'll be listening to are probably on social media as well, like Jill Carnahan and Isabella Wenz. These are great people to get information from. I love it when people say, I want to work with you because I've been following Mark Hyman for the longest time, and I know that this is right for me. And so, they have gotten to a place where they feel empowered to move forward and investing time and energy in their health. So this is who functional medicine is not for. Person who cannot function. unless they have help. I mean, I have a patient who's basically bedbound, and she has a very supportive husband, and she has now the motivation to make changes because she has a young daughter, and so she's willing to move forward in making the changes, but she definitely needs help from her family to make things happen, have the cooking done to set her up for certain things. If they don't have that support and they really can't function, or they're unstable psychiatrically or desperate, a lot of times people are desperately looking for changes, or are in danger. They're not really appropriate for functional medicine, because functional medicine, that approach really takes a lot of, again, investment of time, energy, planning. You have to be able to plan and understand that it's a journey and that it's going to take time. It's not a quick fix. So it's not for people who aren't willing to make changes in their diet or lifestyle, not willing to take responsibility for their situation. And they're looking to the provider to fix them, or they're wanting a quick fix. The challenges for the standard physician are many, and it's mostly because of the way the system is set up. And I am really one of those people that's on a mission to disrupt the system, our current healthcare system. Definitely the mental health system. Time constraints prevent a provider from being able to really drill down and figure out what's going on. You cannot do good care, in my opinion, in 15 minutes. It's just not possible. And so it's not set up in a way that we can really give good care. Feeling that they can't treat without finding the right diagnosis. So from a functional medicine standpoint, we don't need a diagnosis. We just need to understand how is the body not functioning. Again, the purpose of diagnosis is to match a pill to the ill. You don't really need a diagnosis to make changes in your diet. There's so many things that can be done without necessarily having a diagnosis. Again, you'll find from uh, other providers here that many people are not treated because there's no diagnosis, but then they do absolutely nothing, as opposed to something. And if you catch certain processes early on, you can actually reverse them. But once you arrive at a point where you meet the criteria for a diagnosis, sometimes it's too late. You'll learn that from Dr. Toops when you see her, or when you see her lecture about demystifying dementia. So, and a belief that that patients can't that they can't trust the patient's history, or that the patient's actually lying. Belief that they don't want or can't make changes in their lifestyle or diet, and it's also a real necessity for adopting a different model of thinking. Functional medicine is a very different model of thinking than conventional medicine. It's a root cause chronic care model that requires completely different type of training. So I had to go back to school and relearn my biochemistry, relearn my anatomy, relearn physiology, and got trained through the Institute for Functional Medicine, because it is a completely different way of thinking. So just for, some of the listeners in the audience, the most common diagnosis for depression is major depressive disorder. And I just realized I somehow skipped over some of my slides, but that's okay. So approximately 280 million people in the world have depression. Depression is about 50% more common among women than men. And an estimated 21 million adults in the United States had at least one major depressive episode. And this number represented 8.3% of all US adults. And these are the criteria to make this diagnosis. And I'm not going to read it to you. But the purpose of me pointing out this, the criteria, is to let you know that you have to have most of these symptoms. And if you notice that many of these symptoms are physical symptoms, the poor concentration, disrupted sleep, changes in appetite or weight, feeling very tired or low in energy, psychomotor agitation or retardation. And, just getting the flu can give you some of these symptoms. So think about how there are so many illnesses, including a recent virus that went around, that gave many people some of these symptoms. And imagine one assault after the other, and the next, at some point, it's going to affect your brain. So it doesn't take very much to come to finally be given this diagnosis, especially if you have chronic illnesses. Ultimately, everyone with chronic disease gets this diagnosis added to the rest of their diagnoses, and then yet another medication is added to the mix. Generalized anxiety disorder criteria. An estimated 4% of the global population currently experience an anxiety disorder. 301 million people in the world have had an anxiety disorder, making anxiety disorders the most common of all mental disorders. An estimated 5.7% of U.S. adults experience generalized anxiety disorder at some time in their lives. And again, you can see that there are many physical symptoms: restlessness, being easily fatigued, difficulty concentrating, muscle tension, sleep disturbance. There's so it makes I want you to just think about, well, what came first, the chicken or the egg? Did the anxiety come first, or did all these physical symptoms come first? And maybe there's something else that's causing all the symptoms, and it's not all in your head or in the person's head. And the criteria that is the biggest problem for me is this particular one, where it says the disturbance is not attributable to the physiological effects of a substance, for example, a drug of abuse, a medication, or another medical condition like hyperthyroidism. And I can tell you, we just don't do. I know I showed you in the beginning what, or I wanted to show you in the beginning of what blood work is typically done. In the slides, and it really shows that the amount of blood work is very, very little in order to determine whether there is another medical condition, and whether or not there are maybe some environmental causes like mold toxicity or Lyme disease. So what happens is that limited amount of blood work that's completed makes someone, has the provider tell the patient, oh, all your blood work is normal, so you're fine. It must be all psychiatric. And so we don't do enough of the blood work that's necessary. Okay, and okay. So here are some medical causes that are also often overlooked that can cause depression and anxiety. Medications like Chantix, Accutane, interferon, glucocorticoids, which are steroids, some psychiatric medications, benzodiazepines, and anticonvulsants, as well as antidepressants themselves, can cause many psychiatric symptoms as side effects, in starting them, missing them, stopping them. So if they're not done appropriately, you can have exacerbation or new onset of symptoms. And this is just an extremely short list. There's many lists of many more medications, but I don't think we do enough to look at medications as a possible cause for symptoms. It's really important to go through that list and understand when they were temporarily started in relationship to symptoms. And even if somebody has depression or anxiety before the medication started, it could take on a different level of those symptoms. The depression could be worse, or there could be aspect of the depressions that's changed as a result of the medications. So it's not an on-off switch. It's layers. You have to look at look at these symptoms as changing, as if a layer or filter has been added to the mix. And these are medical causes that are also often overlooked. You'll hear from Dr. James Greenblatt when he gives his lecture. He often talks about these types of um, issues: low total cholesterol below 150, having daily suicidality and multiple attempts with a total cholesterol below 80, low omega-3s, low vitamin D, autoimmune disorders like Hashimoto's thyroiditis and lupus. Um, Also, hypoglycemia is often overlooked. I can't tell you how many people have anxiety disorders and panic attacks because of blood sugar dysregulations. And so, this is not typically tested for, especially in adolescents. When we do a workup, or when a workup is done by a standard provider. So what else can be done? And in my opinion, you need to be a detective. And I consider myself a medical or psychiatric detective. And this takes time that most people don't have, most providers don't have. I believe that a great place to make the time is really from the psychiatrist's chair or the mental health provider's chair, because if anybody had time, we do, compared to other providers, especially if you're a therapist. You can start gathering this data in your sessions, and spending some part of the session gathering data, especially if you feel like you're getting nowhere. Start gathering the data, and the next few slides will help you to understand which data to gather. So what I'm going to be focusing on, or going through from this point on, is foods, infections, looking at foods, infections, toxins, stress, and hormones. These are the 5 areas that I dive into. It does, in order to remember it, it does spell the word shift. So stress, hormones, infections, foods, and toxins. But I usually start with food and then go into infections and then look at toxins and stress. And at the end, I look at hormones, or actually all of them at the same time, but the emphasis are in certain areas as I'm working with a patient. We're going to we look at physiological processes like digestion and blood pressures and blood sugars. We look at rhythms, circadian rhythms, rhythms in resting, and rhythms in movement, rhythms with diurnal rhythms. There's so many rhythms that people ignore in their day-to-day life. It's important to, connect back to those daily rhythms. And ultimately, I'll be talking about the 5 R's of gut restoration. So, in a standard evaluation, we generally look at the history of present illness, past psychiatric history, substance use history, past medical and surgical history, medications, allergies, family psychiatric history, social history, mental status exam. If I were to do a psychiatric consultation as a conventional doctor, I would review all of these things, followed up with a DSM diagnosis, assessment, and a plan. I gather much of this information, but then add all of these functional tools as well. I get a 3-day food diary, bowel movement diary, a sleep diary, physical movement diary, complete symptom constellation, toxicity exposure, including mold, a dental history and exam, and I do a full physical exam, and I do a gait analysis. And so these are other labs that we as functional medicine doctors like to order. Fasting insulin, a glucose tolerance test, full thyroid panel. That's TSH, free T4, total T4, free T3, total T3. But I think I said the TSH, the reverse T3, thyroid antibodies, the TPO antibodies, as well as the thyroglobulin antibodies. Getting the ANA, this is for lupus, and the rheumatoid factor, which is for rheumatoid arthritis. HSCRP, which is high sensitive C-reactive protein, and ESR, which is a SED rate. These are two major inflammatory markers. A homocysteine, which is a methylation marker, and also to determine whether or not folate is being utilized appropriately. Methylmalonic acid is to determine whether or not B12 is being utilized appropriately in the body, and a vitamin B6. There's many disorders that are connected to the brain not having an appropriate amount of B6. But I won't get into that today. Maybe another time, because I could say so much about that. Zinc, copper, magnesium, selenium, these four are the most commonly depleted, especially in times of stress. An iron panel, including ferritin. Ferritin is an acute phase reactant that goes up in terms of inflammation. I actually recently had a patient who had an extremely high ferritin level, and doing the detective work learned that anaplasma can cause high ferritin levels. And fortunately, I was able to, get a tick-borne panel on him, and boom, showed up anaplasma, treated that. Ferritin levels been going down ever since, and he had very high ferritin levels, upwards to 1,000 for years, literally years, and only in the last couple months has it finally come down to normal. I got that lab yesterday, finally reached normal. It was like 300 in the normal range. It's not usually that high for most people, even in the normal range. So then there's DHEA sulfate, which is a stress hormone marker. Cortisol is stress hormone, and sex hormones. You'll learn from Dr. Felicia Gersh. I think I'm saying her name right. Later, maybe tomorrow. Yep, Felice Gersh. Yeah, you'll be listening to her talk on day 2 about the importance of getting sex hormones. I get a comprehensive stool test and organic acid testing at practically every single patient, and important genetics, single nucleotide polymorphisms. Shortened is SNPs, genetic SNPs, MTHFR, COMT. But honestly, it's really important to get a full nutrigenomic panel to really look at all the genes, not just these two, but most people do hear about these two particular genes when it comes to mental health. And here. And so ultimately, when you get started with the patient, it's very important to empower the patient and have them understand that it's not me taking care of you. It's you, taking the reins of your healthcare, and I'm your guide, I'm your captain, but we work together to get you better. And so it's letting them know about the limitations of medications and asking them the question, what are you willing to do? What do you want to do? What are you willing to do? Where do you want to be in your life? And what do you want to resolve? And educating them with the information that I will share with you today. So many people are hungry for this information, and some people just don't know what they don't know. So it's really important to plant seeds, and to give them books, to give them pamphlets, brochures about and little by little educating them about what is possible for them in their health. Okay. Advance. Okay. So the primary root cause is inflammation. And so a lot of times people say, well, what does that really mean? So we'll get into that. So inflammation in connection with depression, here is here is a definition. Sickness has common elements that appear across species and infection type, including fatigue, loss of interest, changes in sleep, loss of appetite, psychomotor slowing, and impairments in cognition. This set of symptoms, dubbed sickness behavior, would be, in the absence of infection, be sufficient to diagnose depression. So, as I explained earlier, that, what comes first, the chicken or the egg? Did the depression cause these physical symptoms, or was there some sickness that is not necessarily showing up as an acute infection that is causing the depression? So for the people who are nerds and want to get down to the nitty-gritty, inflammation, depression, here's another definition. It's due to increased circulating levels of pro-inflammatory cytokines such as TNF-alpha and IL-6. Cytokines activate the tryptophan and serotonin degrading enzyme indolamine 2,3 dioxygenase IDO, which may explain reduced availability of serotonergic neurotransmission. There you go. So, ultimately, we want to look at biological imbalances which cut across all organ systems. It's looking at the immune system, the hormonal system, the GI imbalances, the energy production, which is related to oxidative stress, all the environmental inputs, how your body detoxes and transforms the metabolites and eliminates them, looking at diet, exercise, trauma, and looking at structural imbalances. So it's really looking at things in all the corners of the house and understanding how it's all connected. So this paper by Lee in 2019, The Role of Inflammation in Depression and Fatigue, shows links between the peripheral inflammation and changes in the CNS in depression and fatigue. Shows increased inflammation is seen in the periphery on the left-hand side, where it says periphery on the top. In both depression and fatigue, and this inflammation leads to increased permeability of the blood-brain barrier, allowing for easier entry of inflammatory molecules or immune cells into the CNS. That's the central nervous system. Inflammatory signaling in the CNS leads to both structural and functional changes, with the hippocampus being the location of many of these changes. So another example, to give you an outward example, I always like to give examples that kind of reflect what might be happening on the inside, because not everybody is a medical person or even a scientific, person that's, understanding science. People understand that when a tub is overflowing, let's say this tub is on the 3rd floor, and it's overflowing, and you've turned on the tub, you were going to take a bath, you got a phone call, and you've gone, you've had to leave the house and completely forgot, and it's a Friday, and you're not going to be back till Monday. So just kind of imagine what could potentially happen if that happens. It's going to overflow, and think about all the damage that could potentially happen in your home. And, this is a possibility here. Where the whole place is flooded, and just think about everything that is damaged. This is kind of what happens in the body with inflammation. This water, if you understood this water as being inflammatory, and the longer that this water stays in this home, for, let's say, days, weeks, months, and it hasn't been discovered, think about all the damage that can occur as a result of it being there at a standstill, not drained. So you wouldn't necessarily have stove disorder or table disorder or carpet disorder. You wouldn't. This is one root cause that's causing damage in multiple areas and multiple parts of the house. And practically everything has to be probably, once the water is drained, repaired. So our goal in functional medicine is to find where is um, the tap running, and to turn it off and to let out the drain completely. And once that happens, once we're able to find that, then we're able to take the furniture and repair it, throw out the carpet, uh, get new walls put up. Fortunately, the body does have the capacity to heal if you provided the tools to heal and remove the barriers that are preventing it from healing. SSRI have been shown to reduce inflammation, but if the inflammation is too high, they are not going to work and they are just going to poop out. So here's one place where you can, I feel like for some reason, my slides are not coming up because it just skipped a whole bunch of slides. And I'm not sure why that's happening. So what I'm skipping over for some reason, hopefully you have them, is to create a timeline to find all the root causes of inflammation. I'm going to back up a little bit. And the timeline is looking at much of the history that starting from childhood, early childhood, and from birth to actually, getting a family history, pregnancy, birth history, whether it's vaginal versus C-section, bottle versus breast, looking at life during the first 2 years. Life during the first 2 years are so profoundly important to brain development that infants and toddlers who suffer from neglect may never fully recover. Looking at surgeries, periods of stress, concussions, dental work, asking about root canals, cavities, fillings, extractions, and sequelae, major hormonal shifts, particularly at puberty, pregnancy, menopause, andropause, trauma, whether they're physical, emotional, looking at medications, especially those that are given long-term, because many medications, especially recurrent and repeated medications over and over again, deplete many minerals and vitamins that can create other problems down the line. Significant dietary changes, infections, medical hospitalizations, onset of gut symptoms, loss of relationships, parent-child, pet, or multiple losses in a row, responsibilities, looking at responsibilities like caring for children or elderly parents can be very taxing to people. Overwork and stress of work and school, moving into toxic environments, relationships, working at home, and work-life balance, exposures, acute and chronic exposures. And ultimately, when you do this, when you provide a history of how a person has what they've experienced, because they don't really remember, they're only focused on their current symptoms, but they don't remember where it started and how it just built and built and built and built over time. And once they see that, then they realize like, oh, wow, I've been suffering from this for a long time. They have this aha moment, the light bulb goes on and they have this aha moment, and it's then that they start having the connecting the dots themselves. And it's like, oh, I see why that happened. Oh, now I get it. Now I understand. And that gives them the motivation to make changes because of understanding where things went wrong. And they really need to know their why. That's so important to know their why. And they also need to be told that it's not all in their heads and that they're not crazy. So here on now, I'm caught up with this particular slide. So after doing a thorough intake, and the Institute for Functional Medicine really provides a good intake with getting that kind of information, including this medical symptom toxicity questionnaire, which you can download for free from this website. And I encourage you to do your own and get your score. It's a toxicity and symptom screening questionnaire, which identifies symptoms that help to identifying the underlying causes of illness. And you rate each of the symptoms based upon your health profile for the past 30 days. And then you track symptoms by completing the MSQ at every visit. And you're only completing it for a review of the previous 48 hours, not the previous 30 days. So people, when they look at these symptoms, they don't realize that these symptoms are not normal. And they also forget that they had some symptoms in previous visits that they no longer have. So I'll have patients, because I have my patients complete this every single time I see them before I see them. And they'll say, I don't feel better. I don't think anything's working. But then when we actually look at the MSQ, it's like, oh, yeah, that's right. I did have a runny nose. Oh, yeah, that's right. I'm no longer having that ear ringing. Oh, yeah, now I remember. And then they see, oh, gosh, yeah, I am a lot better. And the goal is to get from whatever score that they have down to below 10. So this is extremely useful. I encourage you to go to this, and even do it right now while you're listening to me. Go to this website, and you can just Google Dr. Hyman MSQ, and it'll pop right up, and it's a fillable form. And so the way the medical symptom questionnaire, you basically track symptoms by completing it every visit. You want to identify symptoms to help identify the root causes, and rate each of the symptoms for the previous 30 days. And the scoring is this is how you would score it, and it's at the top of the form as well. And our goal is to bring it to below 10. And I find that people who have mild toxicity, which is 10 to 50, generally, if they really invest the time and energy in doing the work with you, they can get better within a year if they're really focused. And moderate toxicity, 50 to 100, is usually a couple years. And severe would be greater than 100. So I actually use this for people who are interested in working with me, to have people fill this form out so that I can let them know how much time that working with me might take. And it's a estimation, obviously, because it's dependent on many factors. And I'll say give or take 6 months, and give or take how much they're willing to put the time into it. So this is another form, the Promise Global 10 form. And this is used for research. It's a patient-reported outcomes measurement information system. The MSQ is not validated, so it's really good for clinical purposes. But if you want to do research, this would be the form to use. And here's an article from 2019 about the association of the functional medicine model of care with patient-reported health-related quality of life outcomes. And it suggested that this would be a better form. So the next thing that I'd like to point out, and you'll get a lot more information from Dr. Jill Carnahan about this in her talk, The Gut-Brain Connection. And this is the missing link in depression, regulating the gut microbiota using diet, probiotics, and fecal microbiota transplant has important benefits for preventing and treating depression. This is like the crux of what I do, is to find what's disrupting the gut microbiota, and the best way to do that is by doing a stool test. Obviously, also getting a really good history, but there's multiple things that can affect the gut, which I won't spend a lot of time on it. the because Dr. Carnahan will probably talk about all of these things. But one of the things that we want to do is increase BDNF. And some ways to do that is using high intensity interval training, fasting, cold showers to improve this brain immune gut connection. Okay. And one of the things that, oh my gosh, I'm missing a couple slides again. So one of the things that causes increased gut permeability, also called leaky gut syndrome, is increased zonulin, occludin, and actinomycin. Zonulin is so the primary functions of the gastrointestinal tract has typically been perceived to be limited to digestion and absorption of nutrients and for electrolyte and water homeostasis. The other function of this organ is the ability to regulate the trafficking of macromolecules between the environment and the host through a barrier mechanism. So this is the gut lining on the left side is what's considered normal, and on the right side is considered leaky. And so together with the gut-associated lymphoid tissue and the neuroendocrine network, the intestinal epithelial barrier with its intercellular tight junctions controls the equilibrium between tolerance and the immune to non-self antigens. So when there is increased gut permeability, what can happen is large molecules of food, pathogens can breach this barrier and activate the immune system, causing inflammation. And then when there is increased gut permeability, there's also increased blood-brain barrier permeability as well. And this can also lead to autoimmunity and other issues. Lipopolysaccharides is another reason why you can have increased gut permeability. And this is where the meat of my talk is really going to start. And wow. So what we want to do first is get digestion back online, looking at intake of food, cooking, smelling, chewing, eating at the table that's not your desk, eating at regular intervals, and looking at assimilating rest, digest, heal versus fight, flight, looking at hypochlorhydria or achlorhydria, which is low production of hydrochloric acid. We look at the stool test, which shows whether or not you're making enough pancreatic enzymes, or whether or not you're assimilating fats from your food and making enough bile salts. There's also outgo of making sure you're having regular bowel movements. Like I said before, I look at 4 areas: foods, infections, toxins, and stress. Starting with food, we do a 3-day food diary, look at the amounts of carbs, protein, and fats, and bring to the patient's awareness that their mood is affected by food. You'll learn more about that with one of our other speakers, Dr. Umanadu will be talking about that. So the 5R protocol is basically removing foods, and the gold standard is the elimination diet. And modern elimination diet is a Whole30. There's also an anti-inflammatory diet. Mediterranean diet has a lot of literature to support it as it being anti-inflammatory. There's also the paleo and keto diet. So you want to evaluate the patient to determine which diet is best for them based on their history. You'll want to look at the clean 15 and dirty dozen in order to determine whether or not you can eat certain foods that are not not organic. But mostly organic foods are probably the best way to go in general. And then we want to remove infections, toxins, stress. And so in terms of the diet, we want to add in rainbow variety of vegetables, pasture-raised eggs, grass-fed beef, wild-caught fish, rice and quinoa, nuts and seeds, and upward of 35 grams of soluble and insoluble fiber. And swap out these types of foods with alternatives. And I'll just leave this list for you to look at later. You want to take out coffee and alcohol, processed sugar, gluten grains, and replace with healthy gluten-free grains, dairy, vegetable oils, plastic wrap foods, and styrofoam container foods. Infections, we want to remove infections because they cause oxidative stress. There's also an issue with biofilms that can cause recurrent infections. So there's bacterial infections, viral infections, fungal and candida infections. This is one area that many conventional doctors don't believe exists, or they just don't see it unless it's super severe. And parasites are common and not only a third world problem. Toxins, stress. So persistent bacterial infections are a common issue. And unfortunately, many people end up being given all sorts of antibiotics, which then disrupts the microbiome considerably. And there is an assumption that anxiety causes the gut symptoms, but in my experience, it's the gut symptoms that actually cause the anxiety because of those shifts in the microbiome. And then stress is something that, toxins are pervasive around us. We are living in a world full of toxins. And there are toxins in our households. There's toxins outside. So in our home, outside of our home, we're breathing it, we're eating them, we're putting them on our body, on our skin. So it's looking at that load of toxins, and being aware and swapping them out for healthier choices. It's really important to actually prescribe exercise. Movement is really important to be able to move toxins out of your body. It's movement that it doesn't have to be exercise, just moving your body is important to move lymph and support lymph drainage. So getting a prescription, an actual prescription on a prescription pad, if you're still doing that, and really emphasizing the importance of movement and removing toxins as well. There's a great app called Think Dirty where you can scan your products and determine whether or not they have toxins in them. There are so many healthier alternatives for cosmetics and household cleansers, detergents. And it's really important to have an index of suspicion in terms of mold in your school, car, home environment, metal, and you don't have to smell it. If you do smell it, you definitely, most likely have mold. But if you don't have to smell the mold to know whether or not there's mold, you have to learn a lot more about it. So have an evaluation and have someone else remediate it. There's also many issues of metal in people's mouths and hidden infections and abscesses in the mouth. So if a person has a lot of dental work, that's a source of toxins or infection. And then there's pesticides, Monsanto, and with the manufacturing of glyphosate, plastics, which are endocrine disruptors, receipts. These are all sources of toxins that we need to be aware of and reduce and or eliminate as much as possible. And then there's just constipation and liver congestion, lymphatic system. These are all areas that we need to make sure we move toxins out of our bodies by supporting these areas. So then there's stress, and these are normal levels of cortisol that course through our body. This is a usual pattern here, and we want to support our circadian rhythms around that. And just there's many things that you can do for supporting stress, and things that you can take to support the HPA axis. There are a lot of wonderful herbs that are provided in combinations to supporting increased production of cortisol, particularly in the mornings, and reducing cortisol at night. It should be highest in the morning and lowest at night. But many people end up being wired and tired at night and not able to sleep, and then they can't get up in the morning. So herbs are very good to provide because they're adaptogenic. They'll improve your energy level in the morning. If you need to bring your cortisol levels up in the morning, it will improve that, and it'll also bring the cortisol levels down at night. So there's wonderful combinations available in terms of supplements to be able to do that. And here are some other supplements to support the HPA axis in the evening. And it's important to also look at nutritional deficiencies and replace these. These are the most common nutritional deficiencies that I find. So in the beginning, we remove and replace. Remove what's causing inflammation, foods, infections, toxins, stress. Replace what's missing. Those are vitamins, minerals, and other nutrients through food and supplementation, primarily food. And then we want to re-inoculate the gut microbiome after we go through that remove phase, and that would be through probiotics with or without prebiotics. That's typically lactobacillus and bifidobacterium, including Saccharomyces boulardii. There's also some spore-based types of soil-based spores, bacillus species, probiotics. There's a new one called Akkermansia that is found to be very important in terms of blood sugar regulation. And really, ultimately, the best type of probiotic is food, fermented foods specifically. And so we want to, remove the bad bacteria and replace them with the good, ultimately. And we want to improve this bidirectional signaling between the gut and the brain. Your microbiome talks to your brain, and your brain talks to your microbiome more than the rest of your body through this vagus nerve. And that's the cranial nerve 10. And then we want to repair the increased gut permeability. And that would be, again, through foods. I find that the top three to help repair is foods, removing those infections. The number one category that causes increased gut permeability is gluten. So removing gluten from the diet is extremely important, more than any other food category. Foods, infections, and stress is, I've had patients that were Energizer bunnies that would do all the right things to the T, and still have increased gut permeability. And it was really because they were type A personalities and they were go, 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 go. And once they were able to calm their whole body down, relax, not just mentally, but also physically, did they start having an improvement and move into a direction of healing. And what heals the gut lining? Colostrum, bone broth, L-glutamine, short-chain fatty acids, especially butyrate. There's other things like DGL, N-acetylglucosamine, slippery elm and marshmallow extract, zinc carnosine. And ultimately, you want to rebalance. The way you rebalance is figure out how did things topple over? How did the immune system finally go say, Uncle, I can't do this anymore? And try to put things in place to bring balance to your life. So it's creating and maintaining habits, and having community that is really important. So, if you aren't comfortable with, becoming a functional medicine doctor, or, plant seeds and water, and do little by little, in educating people, or refer out to someone who's in your area. You want to track with the medical symptom questionnaire, break down education in bits by giving handouts on breathing, meditation, movement. There's so many wonderful apps out there to support you. And reminding the person that it's a multi-pronged approach. And if you can't find a functional medicine doctor, you can certainly refer to a nutritionist or a health coach. And if you want to know more details about what I talked about, I'm losing my voice, I'm sorry. You're welcome to find my book on Amazon, Kindle, and here's how you can contact me.
Thank you so much, Achina. That was wonderful. We have time for maybe one question. We're out of time, but there are a lot of questions, but there are a couple that sort of rejoin themselves, which is about timing. And so is there a recommended timeline between the 5 Rs, or are you doing these simultaneously? And that sort of rejoins another question about what might your first session be in terms of, what is the sort of timeline and how you approach the complexity of this treatment?
Right. Well, we always start with the gut. And so, if you don't know where to start, you start with digestion, because nothing's going to work if your digestion's not working. So, even if you give supplements or food, if you're not breaking down and assimilating food, then it's just gonna, it's no one's gonna get better. So you really want to. I always start with digestion, making sure that someone is, chewing their food, swallowing their food appropriately, and not just, vacuuming it down. So eating the right food, making sure that they're digesting appropriately. I have people do a burp test and it's called a colon transit time test, even before they meet with me. And then, so having them make sure that they are from mouth to anus working. And then food is the next best thing, having them change their diet. And so working with a nutritionist would be helpful, in terms of finding the appropriate diet based on their history. And then during that time is when I do testing, the stool test and the O test and other blood work. So, and at the 2-month mark, when they come back in, we go over the testing and we go through a kill phase, of sorts. And that's about a 2-month to 3-month, depending on what that is. If it's candida, it's usually much longer. But the one thing that's really important to know up front, and that takes an index of suspicion, is mold. If you know that someone is living in a moldy home, nothing is going to get better. They have to get out of a moldy home. So it's asking those questions and also screening for Lyme and co-infections. So that's all part of testing, the testing period, and looking for dental stuff. So those three things, you really want to have a very strong index of suspicion, because that could really disrupt someone from getting better. So history is really important. And then starting with food, digestion food, and treating the chronic gut infections.
Got it. That's fantastic. Well, there are so many more questions, but unfortunately we don't have time. But thank you so much, Achina. That was super helpful. 101, amazing, like speed overview of functional medicine psychiatry. So thank you so much.
Thank you.